Goodness. No, post recording.
Here while we talk about why claims get stuck and how to fix the real root causes. Together, Vyne Dental and Zentist are here to share practical insights and actionable strategies to help your teams identify bottlenecks, resolve underlying issues, and keep claims moving efficiently. If you work in dental revenue cycle management, you already know the frustrations. Claims don't just get stuck for no reason. Instead of talking about surface level fixes, we'll dig into what's really causing claim delays, from front end data attachment workflows to payer requirements and posting inefficiencies. So let's talk about it. Why do claims get stuck? Insurance claims get stuck for a reason most teams never see, starting with issues like eligibility of benefits and missing documentation, and ending with failures in payment posting, remittance management, and denial tracking. In today's session, we'll take a closer look at Vyne Dental's verification and attachment workflow. Megan will share best practices for preventing early claim friction and outline practical steps your team can take to strengthen your practices from the start. Then the Zentis team, including Cheryl and myself, will demonstrate how automation and structured remittance data help eliminate the far more costly downstream bottlenecks that slow down payments and create rework. Our goal is that you leave today's discussion with a clear end-to-end blueprint for keeping claims moving smoothly from submission to payment without unnecessary delays. Before we go any further, um, let me introduce the panel of experts we have here today. I'm Anna Poliano, Product Operations Manager with Zentis. I joined the team about a year ago. Prior to that, I spent 20 years working with different dental organizations, helping drive efficiency and growth. And let me introduce Cheryl.
Thanks, Anna. Hi, I'm Cheryl Dean. I'm also a product operations manager at Zentist, and I've been with Zentist for over 5 years, and I've spent 20 plus years in dentistry and the healthcare industry. And now for the star of the show, here's Megan.
Thank you, Anna and Cheryl, for allowing me to be here today to represent Vyne Dental. I accidentally stumbled into dental tech about 8 years ago and have loved learning best practices and being a super strong resource that my customers can trust. All right. We're going to start with the upstream friction with the Vyne Dental side here. Most claim delays are actually preventable. They're not random and they usually fall into very predictable buckets. Today, we're going to walk through the three biggest reasons why claims get stuck and, more importantly, what you can do to fix them before they ever become problems. I want to get started with a quick quiz. I'd love for you all to use the chat feature here in the webinar to post your answer, and let's see how you do. What percentage of claim rejections are due to incorrect insurance information? So go ahead, post your answers there in the chat. I'm excited to see what you all think. All right, definitely seeing some good answers in there. Let me see. Perfect. The correct answer is C, 25%. Now, let's think about that for a second. That means 1 in 4 claim rejections are happening before the claim ever even has a chance. And it's simply because something isn't matching what insurance has on file for your patient. The usual culprits could be incorrect patient or subscriber information, a missing middle initial, even relationship errors, or worst of all, the patient has completely switched insurances and no one's caught it. Typically, this isn't a billing mistake, it's a front office workflow gap. Insurance changes all of the time. Employers change their plans, patients get new jobs, insurance cards don't get updated, and that's even if they get insurance cards or have their insurance cards, right? The fix is easier than you think. It's making sure that your process is proactive. Ask about insurance changes regularly, not just once a year. Bundle your insurance update forms with your appointment reminders and make sure that your forms are actually working for you. Have the patients upload their new insurance card as a part of their forms packet before their visit. Bundling forms with reminders is a huge time saver here. The goal is simple. We need to catch the changes before the claim gets submitted. The second big issue here is eligibility and benefits breakdown errors. If you're not verifying coverage in advance, you're reacting instead of controlling the outcome. You should try to work on eligibility checks whenever possible and automate those. We typically recommend at least 3 days in advance. And the point here is to verify the coverage before the patient is ever in the chair. Using a system like Vyne where the eligibility tool will detect ineligible insurance information and automatically send the patient an insurance update form, saves you time and your voice. How many times just this week have you asked any changes to insurance? Then there's the benefit breakdown accuracy, where teams lose a ton of time. And here's how you can pivot. Document your benefits, the patient's benefits precisely. Use structured systems, not sticky notes, with tools like Clear Coverage that provide digestible, uniform breakdowns with the ability to search by procedure code or category. Store your breakdowns directly in the patient's file so they're easy to reference later on. And when you do have to call insurance, save yourself time by knowing exactly what you're trying to confirm once you do finally get a hold of that insurance rep. The reality is, clarity on the front end prevents uncomfortable financial conversations on the back end. The third issue of why claims get stuck is pretty simply dirty claims. Attachments matter more than most teams realize. Confirm what documentation is required by code, by insurance. Different insurance carriers will have different attachment requirements. Using a tool like the carrier list inside of Vyne will allow you to look up procedure codes and attachment requirements so you can get what you need from the patient before they ever leave the practice. Having a system that actually scans your claims before submission will help prevent missing attachment requirements, aka avoiding preventable delays. If you're using tools like PerioSync or ImageSync, those can dramatically reduce the attachment errors and save you some clicks. But it's not just the attachments that are important. You also have to be aware of missing information being submitted on the claims. What you can do here is make sure that you're sending out forms that write back into your system to ensure the data in your practice management system is complete and accurate. Proper claims routing could also be to blame for your delays. Make sure you're keeping an eye out for accurate insurance carrier addresses and those payer IDs. If either of those pieces of information are off, your claims could drop to snail mail and you'll be left wondering why you haven't been paid yet. The point is, even the small details here can be the difference between a 10-day payment or a 45-day delay. Now, I know that I said I only had 3 reasons, but I actually wanted to throw in a bonus tip for you here. Real-time claims. A real-time claims payer will provide immediate responses from insurance carriers like MetLife and United Concordia, so you know what's going to be covered before the patient leaves the practice. This is huge. This means you can easily collect a more accurate patient portion up front, reduce the follow-up work and the back and forth between insurance and the patient, and essentially get paid faster. That's less rework and a stronger cash flow. You'll be the doctor's favorite in no time. Completing the upstream work is critical. Without that first link in the chain, you're simply postponing the inevitable and will eventually have to go back and rework those submissions. Remember, try to focus on accurate insurance information, clean eligibility and benefits breakdowns, clean claims with proper attachments. If you tighten up those 3 areas, you're going to dramatically reduce rejections and delays. Your system should work for you. Make sure whatever tools you have in place assist you in getting paid faster, not just checking the boxes. And with that, I'm going to pass this over to Cheryl.
Thanks, Megan. You've given us some really great information and tips. Now let's look at the downstream critical issues. So, fragmented EOB ERA data is a huge problem in dental billing because it breaks the connection between what the payer paid, what the practice expected, and what the patient still owes. Fragmented EOB ERA data causes posting delays, inaccurate balances, missed revenue, and tons of manual rework. And it prevents the practice from having a clean, reliable AR workflow. Payment posting becomes slow. You're trying to decipher what should have been paid versus what was actually paid, what needs to be written off or charged to the patient. The team can't reconcile payments correctly because of discrepancies in what was expected versus what was actually paid. Denials and underpayments get missed. Patient billing gets messy. They get charged for additional amounts they weren't expecting, and so they get angry. And AR follow up becomes reactive instead of strategic. When you're relying on manual processes, this delays the statusing of age claims and further delays payment due to the time consumption in communication with payers. Reporting and forecasting becomes unreliable. Time spent on manual reconciliation can drain productivity and produce misinformation. And let's face it, it increases manual work and causes burnout. Anna, talk to us about manual posting.
Yeah, absolutely. Thank you. Yeah, manual payment posting forces teams to rely on human efforts instead of automated workflows, making the entire revenue cycle slower, harder to scale, and more dependable on individual staff capacity. It's extremely time consuming. Manual posting takes significant staff time to track down remittance details across payer portals, chase missing EOBs, make follow-up calls, and work denials, pulling focus away from higher value tasks and putting pressure on the practice's cash flow. It's also extremely error prone because posting is often done while staff are multitasking and being interrupted. Manual entry is highly susceptible to mistakes. Even small posting errors can lead to incorrect patient balances, missed underpayments, lost revenue, and increased rework for the entire billing team later down the line. Manual posting creates operational bottlenecks that slow down reconciliation and delay claim resolution. This impacts everything downstream: AR performance, patient billing accuracy, and the practice's ability to hit financial targets and maintain a strong patient experience. Cheryl, can you talk a little bit about denial patterns?
Sure. So untracked denial patterns, it is another critical issue. Most practice management systems don't have the ability to track the denial reason for procedure codes. And without this visibility, it's difficult to determine where problem areas lie. Let's take, for example, scaling and route planning. There can be multiple reasons these codes are denied. Sometimes it's because we do all four quadrants at the same visit, but we don't include a narrative as to why we were able to do this. And most insurance only pays two quads at one visit. Sometimes it's denied because they didn't receive the proper x-ray or perio charting to show that 5 millimeter plus pocket depth. As Megan told us earlier, making sure we have all of the required attachments at first submission is critical. If we don't, this delays claims processing, and in turn, our aging gets out of control. Let's hear again from Megan about Vyne's upstream value.
If you remember one thing from me and Vine today, it's this: your pre-submission pre-work drives your payment speed. Vine Trellis partners with customers to connect the dots between patient, provider, and payer, solving what we refer to as the dual payer problem. On this slide, these are just a couple of the tools that we offer that connect the patient, provider, and payer, not just conceptually, but operationally as well. Unlimited electronic forms allow you to collect the most up-to-date information on fully customizable forms before your patient steps foot into your practice. Unlimited eligibility and benefits help you easily understand what's covered with clear coverage and sends out insurance update forms to patients whose eligibility returns as ineligible. Claims and attachments make submitting and tracking claims with built-in claim validation and attachment requirements simpler by keeping your claims clean. The key here is integration. When intake, ineligibility, and claims live in different systems, gaps form, and those gaps equal delayed payments. Vyne Trellis brings it all together in one connected revenue cycle management workflow designed to reduce friction at every step. The result here is providers using Vyne Trellis Core save an average of $4,000 per year per practice. That comes with fewer denials, less manual rework, improved staff efficiency, and faster reimbursement cycles.
Thanks, Megan. And our Zentist products help with the downstream by pulling in ERAs and EOBs that are available on payer portals and converting them into a standardized format. We do this with our Remit Go and our Remit AI products. In addition, our Remit AI product uses your organization's bank data to surface daily EFT deposits directly into the dashboard. And from there, we automatically match each remittance to the corresponding bank transaction, eliminating the manual work that your team typically has to do to reconcile payments. And if you enable our auto posting feature, Remit AI can automatically post 80+% of payments directly into your practice management system for Denticon, Open Dental, Dentrix Enterprise, or Dentrix Ascend. On top of that, we use AI to analyze remittance details for both RemitGo and Remit AI and intelligently categorize denials, making it easier for your team to quickly identify which claims need attention and why. Now let's hear from Anna on connecting the dots.
Yes, thank you. So Vyne Dental prevents avoidable claim issues up front. Zentist automates payments and denials after claims are received. Together, we create a full cycle approach that improves claim quality, speed of payments, denial prevention, as well as management, and the overall revenue performance. Vyne prevents avoidable claim delays by verifying eligibility and ensuring required attachments are submitted up front, while Zentist reconciles your EOBs and ERAs, automates payment posting, and uses AI to detect denial trends, turning payer responses into actual intelligence. Now let's look at the results of automated workflows. We have faster posting. Manual posting typically takes 5 to 10 minutes per claim, while automations cuts that down to 2 to 3 minutes or less. Wow, that's a reduction of more than 70%. It reduces rework. ROI improves with fewer payments requiring manual cleanup. The team spends less time hunting for missing EOBs and ERAs and fixing mismatches. When manual work is reduced, ROI improves because the business lowers labor costs and can process more volume without adding to the overall headcount. Now, Cheryl, can you talk a little bit about denial recovery?
Sure. So the Zentist Analytics dashboard allows reports that can help with denial tracking and management. So our denials drill down by payers, procedure codes, and denial categories. These reports allow you to see which procedures a particular insurance payer is denying and why. Among these is the most frequently denied procedures report, which shows you which procedures are denied most often and helps to prioritize problem areas for codes that are not going out clean. And our actionable denials section allows for full visibility to prioritize workflows and see potential income once these are addressed. The bottom line, stop fighting the same stuck claims every month. Scan our QR codes to schedule a run through and let our teams help you. With that, we want to thank you for taking the time here at month end to learn how we can help you. Let's open it up for questions that you may have. And we'll get your microphones turned on so that you can ask those questions. Don't be shy.
Ladies, I'm not sure if you scrolled through the chat. It looks like there was some questions, maybe for Vine. There were some questions for us, Cheryl, in regards to if we have a manual posting team versus if this is a company. Scanning that QR code will provide some information since this is a company, and we automate the system. So we pull that in that data on the auto posting. It's done automatically within your practice management system.
I think there are some questions in the Q&A chat as well, mostly for Megan. So you want to take a look?
You guys want to talk to me? Okay. Let's see. The first one we see here is we've noticed too often our insurances are marked as eligible in Vine Trellis, but when we call for verification, it is not active. Here's the thing with all eligibility across the dental space, not just Vine Trellis. It is using AI, as is talked about a little bit further down in the chat. So when we submit the information over to the carrier, what comes back is directly from the carrier. If you're noticing that, that's not supposed to be happening. I will put my email in this chat. Please send me an email with your facility ID and some examples so that I can escalate that to our product team. That's not supposed to be happening, and I want to get that fixed for you. We have an issue with Vine attaching the wrong payer IDs to a claim, which doesn't match the payer ID we have in our system. Here is a helpful hint for that. Make sure that your payer ID is matching the address that you have on file. There's a whole wonderful world of claims routing and claims mapping inside of the clearinghouse. So it's important that both of those items line up according to what's on the back of the insurance card. I see some insurance saying they don't get the attachment. When you're calling them to provide that NEA number, they can take that NEA number and put that in their provider portals that they have through NEA to be able to pull up that attachment there. So that's a little hint for you. If they didn't get it, they definitely have the resources to go in and find it with that NEA number.
Someone raised their hand. Maybe they want to speak. Edward?
Yes,
Edward, yeah.
yeah. So I had a question. So sometimes when we are sending pre-auth, and most insurances like Delta Dental and United Concordia, we send a pre-auth, and the insurances never get the pre-auth. Now, if we send a claim, they will get it, but I'm not sure if there's a difference of why they're not getting the pre-auth, or maybe, like you said, maybe we don't have the right payer ID.
Yeah, what is your practice management system?
It is Open Dental.
Open Dental. Okay. Um, I would escalate that with the support team because obviously that's not supposed to happen. Claims and pre-auths should be treated the exact same way in our system. They should be sent regardless. I would escalate that with the support team and give them a patient example so that they can go in and take a look on the clearinghouse end.
Thank you. And I
Yeah.
did see somebody had a question about having problems sending dentures with Humana. We have the same issue sometimes when we send like a pre-auth for a denture with that insurance Humana, or for a payment, they never get it, and I'm not sure why.
Okay, let me scroll down here
And I
and
think someone
see.
else did ask that.
Let me get through here. Crystal Collins, Collison, I'm sorry, it was cut off for me. If your PerioSync is not working, you need to escalate that to support. It's a pretty simple fix. Again, I'll enter my email in the chat for you guys as well, so that I can help you kind of get these issues taken care of as well. Lots of talk about AI, using AI to kind of go through the adjudication system. For SRP claims, do we need to attach the oral cavity code? The oral cavity code I've noticed over the past couple years has kind of gone back and forth. Sometimes they
Yeah.
want UL, sometimes they'll want 10, 20, 30. It
Yes.
really just depends on the insurance carrier itself. Um, some of them don't want anything at all because they don't care. So it really depends on the insurance carriers that you're submitting to. Get through here.
Megan, somebody asked if Vine Trellis is different than just Vine. They say we use Vine for our claim submission.
You likely are using Vyne Trellis then, unless you're using Remote Light. So Vyne Dental is the company. Vyne Trellis is the claim submission platform that we have. We do still have customers on Remote Light, which is still a Vyne product as well. I saw a question for Zentist in here. What about EagleSoft? Are the platforms mentioned the only ones that integrate with it?
So for the auto posting, just the ones that we mentioned is what we have that available for. But the rest of the platform can still be utilized no matter what PMS that you have.
Yeah, there's a lot of value and benefit for teams. They can still benefit from the reconciliation portion of our product. They can help match a lot of the EFT payments that hit your account to your remittance data to help with the posting for your office and reduce that manual work that your team is doing, finding that data within the different payer portals. You can also still take advantage of the denial management aspect of things because we pull in data not just for the EFTs, but also any of the check payments that are still coming through, and then displaying those on our dashboard. So there's a lot of functionality that is still very beneficial, regardless of the practice management system your offices are utilizing. And yes, our team, if you scan that QR code, we can definitely schedule a demo and provide some additional information for you regarding the dashboard and additional functionalities that we have.
It looks like Misty asked, so Zentist, is that a system or people who manually post? I'm the only person who works all of our claims and post payments. We have 4 dentists and 7 hygienists.
Cheryl, do you want to take that one?
Oh, sorry.
Either one.
Yeah, no, that's fine. That's fine. What was the question? I'm so sorry.
Yeah, it was, is this a system or people who
Oh,
manually post? I'm the only person who works all of our claims and post payments. We have 4 dentists and 7 hygienists.
okay. So for the auto posting, that is automated. The rest of the system, it's automated in that we bring all of your data to one place. So we do provide everything in, on the platform so that it does save you time. You're not having to go to all those payer portals looking for your EOBs or EFTs. We bring in even for the checks and VCCs, we're pulling that data from every insurance portal and from clearinghouses as well, so that we're able to provide everything you need. So it does improve your speed of being able to get through those payments manually. But we don't have, we don't have a human that's actually doing the posting for you. If you have Open Dental, Denticon, Dentrix Enterprise, or Dentrix Ascend, it is automated auto posting. And then I see we have some more hands raised as well. Kim and Sarah. I don't know who was first. Sarah, you want to go first? You had a question?
You might be muted. It looks like Kim is muted, but
They have the permission to unmute. Yeah, okay.
I'm unmuted, I think.
Yeah, there you go, Kim. Go
Okay.
ahead.
So in Vine, when a claim is sent, but we call the insurance company and they say they don't have it, in Vine it says entity accepts claim. Does that mean it's accepted through Vine to go to the clearinghouse, or does that mean the insurance company accepted it?
Repeat what it was, entity what?
It says entity accepts claim.
Entity accepts claim.
If you click on the claim receipt, it'll tell you whether or not they received it.
Yeah, perfect. So within the first 24 hours of claim submission, that initial accepted status means that we have successfully received it electronically and sent it over to insurance electronically. If you're seeing that after 24 hours, I would double check with insurance because that should mean that they have received it. We've sent it. If they're saying that they don't, that's when I would give them that claim number as proof of submission.
And I have one more question.
Sure.
So I have a claim I've been working on for a long time, and I really need to let it go. But it's with Humana,
Uh-huh.
and it's a perio code. So I sent the perio charting, and I called them as early as this morning, and the girl said that they can't accept it because it's not charted in black. They can't read any other color of ink. I said, well, I printed it and mailed it, and it prints in black. But she says they can't read it unless it's in black. But it is in black. So
Wow.
when it's in color and it's in electronically, shouldn't they still be able to read the numbers
Yes.
for the charting? I mean,
Yeah, I have never heard that before.
Either.
I'm gonna post my email for you if you'll send me your facility ID and that claim, either the claim number, the patient's name, and the fee total. Let me get some of my claim experts on it so they can take a look at it and hopefully we can help you get it moving.
okay, that sounds great.
All right.
It's definitely a new denial tactic with prolonging your claim payment.
Oh
They're so
my
terrible.
gosh.
Well, this
Oh,
claim is,
awful.
I've been working on it since August.
Oh, wow.
Unbelievable.
I'm done
Wow.
today, but I will send it to you guys.
Okay.
I'll send it to you, Megan.
All right.
I'm also seeing from Keely in the chat, are the EOBs detailed as they would be if we get them from the insurance company? And the answer to that is yes, it is the same EOB. So we're pulling those EOBs from the actual payer portal. So it's the same thing that you would get in the mail. We also pull in ERA data. So we have both available. But yes, it's the same format. And it is downloadable from our platform as well, so that if you need to send it on to the secondary insurance, you can do that also.
And with the auto posting feature, it's actually also attached directly into that payment. So
Yes.
as we post those payments, they actually get linked directly to your patient's ledgers, which is really convenient for your administrative teams or anybody who is doing any risk submission, because you actually have that available right there at your fingertips, not even needing to look into the dashboard.
And Jill, related to that, no matter what your PMS is, we still pull in all of your data. So we pull in your bank data and we pull in all of your EOBs and ERAs. We match those remittances to your bank transactions. So you have that information all collected together, as well as we're pulling in any EOBs or ERAs related to checks or VCCs. So that is not specific to a certain practice management software. Any practice management software can utilize the Remit AI platform.
Megan, I'm resharing your email address because it was previously shared with host and panelist only.
Oh, sorry.
No worries. So
I've
it's
probably
there
been
now.
responding to these comments to host and panelists only. I'm so sorry. I'll change it to everyone.
Yeah, because I haven't seen it yet either.
Looks like there's some more questions for you, Megan. How long are claims sent, stored in Vyne, Remote Light? I have been working my past due claims, but when I try to pull ones that I sent back, say 90 days or more, it says not found, but I know they were sent.
Yeah, so in your, did you say you were using Remote Light specifically? That's what.
It says, yeah, it says remote light in parentheses. Yeah.
Okay. Yeah. So when you're using your remote light, if you go to the claims archive icon and search for it there, it will show you the proof of submission from there. You should also be able to use that calendar icon to go back at least 6 months. Sorry, I'm trying to get through the comments, trying to see here.
There's a lot.
There's
Yeah,
so many.
I know, which is great. It's great. Sarah, I know you still have your hand up. Is your microphone working? Oh, as I see, I just got to your chat that said our microphone is not working. When our claims are sent from Dentrix to Vyne, it will say ready for a crown, for instance, before we even have added the attachments to the claim. When we trust the system and send it, is it denied?
Is it denied? The crown. Okay. So I want to explain a little bit kind of how the attachment system works and how the requirements are flagged inside of our system. We have these connections with these insurance companies, and when they update their requirements, they let us know, and then we update those requirements in the back end of the system. Now, I have had this conversation with many office managers, treatment coordinators, all of these people who say these crown claims need an attachment. They're going to deny it. I think there was a statistic that came out sometime last year. It was like only 30% of attachments that are sent to insurance are actually viewed by insurance, which is mind blowing, right? Because they're so quick to deny because it doesn't have an attachment to it. What I would tell you is give it a little bit of trust. Send it, see what happens. If it doesn't come back as rejected, you've saved yourself a minute, 30 seconds of time trying to get those attachments on there. Um, Jasmine Garcia, your message about always listed as spouse for dependent listed on the policy, you need to either contact support so that they can uninstall and reinstall, or you can uninstall and reinstall yourself. That's a template issue, and that will fix that.
Asking questions about the eligibility part.
Buki, we're still recording, aren't we? So that we're getting these questions and answers on the recording.
Yes, absolutely.
Okay,
Yes.
great. Someone asked that, so thank you.
I think this is a Zentist one. Are adjustments then automated with the payment, or do we still have to enter the adjustments?
The adjustments are automated with the payment, and we can actually set up customizations. So if you have specific things that you want adjusted off, we have a client who doesn't want the patient to be charged for any x-rays if they are denied for any reason. And so we train the bot to do specifically the same thing a human would do. So if you have specifics like that, we can customize, and we definitely, would be able to do adjustments. We also have in that auto posting what's called pre-posting, where we still auto post the payment into your patient's ledger, but we leave the claim open for you to look at it and make any adjustments that might be needed before you close the claim. So there's the option to do both, have them actually closed if everything is perfect, or to also have it pre-posted and left open for you if there's scenarios that you maybe want to double check before that claim is actually closed.
Yeah, very good. And to add to that, when we do the posting, it's very provider specific based on what's in your practice management software. So all of those adjustments as well as payments are very line item to each of the providers that you post your services under, because we recognize how important that is, as most are paid on collections. After that closing of the claim is done. So yes, they're automated and they're individualized to the provider level.
I saw one in here about the 90 character limit on the claim inside of Vyne. There is a 2,000 character limit on the one in the attachments tab, so the narrative box. What you can also do outside of typing all of that information in there, if it's already like in the patient's file, you can actually take a screenshot of that and make it an attachment as well. There's an option to label that as narrative as opposed to like X-ray or perio charting. Misty said, I think you said this, but with Zentist, the auto posting is not available for Eaglesoft, correct? But we could still use the program to have all the EFTs pulled to that one site, sorry.
Yes, that is correct. Unfortunately, because Eaglesoft is server-based, we do not have a connection to get into your practice management system. However, there's still a ton of ways that you can benefit with time savings by having that information brought into that one site to automate your posting with your internal staff by not having to search for those EOBs or ERAs and do that reconciliation piece, because we will work with still pulling in that bank data and then matching all of the remittances to it.
Sorry, guys, have we taken the question on adjusting ERAs? Zentist team?
I don't think so.
Okay, so there's a question from Kathleen Johnston saying adjustments on ERAs, are they adjusted based on our PMS fee schedules or based on what the rate of adjustments should be according to the carrier's EOB?
So we post according to the EOB, but we also note like if there if we also the bot also looks at the patient's ledger to see what's in the patient's ledger. So for example, if there is a contract discrepancy or some discrepancy, we would maybe note that we made a positive or a negative adjustment based on what was on the EOB. But again, we could leave those as pre-posted so that it requires someone to actually look at that and make a human determination as to whether they need to make a correction. Maybe you need to update the fee schedule for that patient. And so there's that capability of allowing you to make sure that it's accurate before the claim is closed.
Hi, Karen, you have your hand up and you're allowed to speak now.
I'm kind of back with Edward. I've really been struggling with sending out, like, say, to Humana, a denture pre-auth. We have tried to put everything in. I even talked to a representative on the phone, tried to send it again, and it's been literally a month. And so we put everything in we could think of, and it still said CDT is the issue. And we ended up just hand mailing all of our claims.
Just one second. I want to take a look into our clearinghouse site, so maybe we can solve this in real time for you. Oh. Okay, what is the ADA code you're submitting?
Oh dear. I don't know right offhand. It was for a full denture.
Okay.
Like a 5110 or like a 5130.
Shoot, I don't have mine up. Let me pull it up real quick. Let me get into my Vyne. Okay, rejected. So code we're sending, yeah, is a lower denture 5214 and an upper denture 5110.
What's the insurance carrier?
And it's Humana. We've put in the oral cavity. We've tried to put in teeth numbers. And like I said, we've fought with this all month, and the patient was, wanting answers, and we finally just hand mailed it. But yeah, the doctor and I have both tried to just put everything we could think of in there.
Yeah. And when you said you put the oral cavity code in there, you put like O1 or O2?
We didn't know, so we had no idea. We put lower and upper.
Try O1 or O2. And if that doesn't work, send me an email so that I can look into it.
Okay, O1 or O2. So like, would it matter whether it's the lower or upper denture or
I believe O1 is upper. Let me
is
confirm
upper?
that.
I believe so too.
Okay, where would we go to get that information?
To be honest with you, it depends on the insurance company. Some of
Okay,
them don't, some of them, if it's a lower, they don't want an oral cavity code at all. They're like, "Eh, we don't care. It's lower. We understand it's the whole
right,
lower."
okay. So it's more of a number, O1, O2.
Yes. O1 is upper and O2 is lower.
Lower, okay.
And then I'm going to post this link in here for you guys as well. This is directly from our Vyne site, but this is the common claim rejection reasons, and it has a really cool chart in there that shows you the quadrants and the oral cavity codes. That's always what I use to go double check myself.
Oh, that would be great. Thank you.
Yeah, you're welcome.
Kim, did you have another question? You're on mute if you're talking.
Now, can you hear me now?
Yes, now we can.
Okay.
Yes.
So I've had a couple times where I've sent an electronic attachment and then had to call to follow up on the claim. And they say, well, we don't have it. And we give them the NEA number and they say they still don't have it. Are they just delaying or is there something amiss?
I would say they're likely delaying. Like I said, most, if not all of those insurance carriers have if you've ever used Fast Attach, you have an NEA portal.
Yes.
You can log in and see all
Yeah.
of the things that you've sent. The providers have that on the provider side where they can see all of the attachments they've received, whatever the case may be. If you're using Vyne, you can actually use the standalone attachments to resend it. Just ask them for a carrier reference number so it'll attach, and then they should receive it that way if they're still saying that they didn't get it.
Okay. And also, you're sending us your email.
Mhm.
Have you done that yet? And we're not seeing it, or
Yeah,
you're
let me just tell you what it is. I'll say it out loud, and then before we end this, I'll send it again. It's my name, Megan, Megan Cannon, Cannon at vinedental.com.
thank you.
You're so welcome.
Okay, I'm just making sure my name's there. Anything else you can think of?
There's a question on the accuracy of our auto posting, the percentage accuracy. Have we answered that, Cheryl? Anna?
No, we have not. So we're auto posting close to 85% accurately.
Not incorrect, rejected, whatever.
Okay. They're also asking if we have for Dentrix and Dentrix Ascend or if it's planned.
We don't for Dentrix Core, but we do for Dentrix Ascend. Dentrix Ascend and Dentrix Enterprise.
So that question's answered.
Messenger. Just making a note of the message.
And I believe the recording, Buki, will that be emailed to attendees?
Yes, yes, yes.
Yeah. So
there's another question in the Q&A by Ruby O. Is there a list we can have that shows which codes and numbers to use when sending secondary claims? For example, the OA and 23 codes.
I think, Megan, that's probably for you.
I'm over here talking and I muted myself. Yes. Let me find those resources.
Oh, you're still
There
doing it.
is a
Oh. Oh. Oh, man. Go ahead.
send me an email. The link I have is not a viewer-friendly link, if you know what I mean. It's pretty extensive and hard to read. Send me an email and I will get the list together on like a Google Sheet or something and send it to you. When you're doing that OA and 2-3 kind of secondary claim adjustments, it's important that you know that the reason you have to do that is because insurance carriers are making the switch to not wanting to see that secondary attachments. So those EOBs, they just want that information in the remarks section so that that claim can run through the adjudication system.
Good to know.
That makes sense.
Megan, there's a question. Is it correct that any punctuation characters in the insurance address will reject the claim, like using the decimal in PO box?
It's possible. Again, most of your claims that are going through to insurance these days are being sorted through their adjudication system, which is likely being implemented with AI. What I would suggest is if you're having an issue like that, if you click in the carrier name section on the claim in your unsent or sent tab and type in the payer ID or the address and select it from that list, it should map correctly with no issues.
Raymond, this is your medical card.
That's not what I gave.
It's medical. Your dental, it didn't change.
It didn't change?
No,
That's good.
it's still Cigna. You're okay.
Okay, that's good. But we thought it all changed.
Well, I'm not sure they clarified that very well because I've had other people tell me the same thing, that they thought the same thing.
Right.
But we filed several,
Okay.
and Tracy got the coverage verified, so I feel good about it.
Do we have any other questions, ladies? I'm looking too. I don't see anything.
I see there's, Megan, there's also one from Cole. Did anyone find where to edit the attachment requirements notifications in Vyne?
Cole, are you referring to like adding custom validation rules for attachments in Vyne? Yeah, so that actually was on the roadmap at one point. I'm unsure where it is currently, but here's what I'll tell you. If you go into your Vyne Trellis account, up in the very top right-hand corner, there is a green question mark and a place where you can share your feedback. That feedback goes directly to a portal where you can see other people's feedback suggestions. And our product team, our support team, our sales team, all of the teams look at that. And that plays a huge part in, what gets put on the roadmap and what gets put into production and things of that nature. The cool thing is when they do put it into production, you actually get an email about it. They'll let you know like, hey, love this idea. It's being worked on. You can expect it in XYZ.
Nice.
Of course.
Maureen is asking for Delta Dental claims that are getting rejected, but the patient is covered. You suggested that we must have the exact match on. Where do we go to change this in Vyne?
What are we talking about the exact match on? Are we talking about the address for the payer? Any edits to the claim you can make in the unsent tab or the sent tab. So when you click in there, you'll be able to edit that information and resubmit the claim from there. Yeah, please do.
Mm. Awesome. Any other questions? Hopefully we've caught all of them. One more for you, Megan.
Yes. When you make changes to the submitted claim and then resubmit it, would the insurance company know to disregard the initial claim and work the updated one? Yes.
Depends on the day. Yeah. Hmm.
Come back as duplicates for us. Yeah, what I would do is if you're seeing a lot of duplicates or things that are popping back as duplicate, I would update the remarks section and just say edited claim, or there's a better word for edited. I just can't think of it right this second.
Corrected.
Corrected. There we go. Yes, corrected claim. There we go. Yes, Misty, thank you. Corrected claim. That way it's enough of a change on the claim that it won't pop back as a duplicate.
And if you have the previous claim number, yeah, there you go. That also helps. I agree, Cole. Mandy asked, how helpful is adding diagnosis codes?
I think it's going to depend on the insurance company. I think you kind of have to teeter the line of how much information is too much information with insurance. I also think it depends on the codes and things you're submitting as well. Cassie, if you're adding corrected claim into your remarks and it's still coming back as duplicate, call into support or send them an email. It's called a duplicate claim push, and we can provide that on the back end for you.
Nice. Thanks, Spooky. Thanks, everyone, for joining today. We appreciate it, and lots of great questions. Hope we've been able to answer everything for you. And good luck with your month end.
Yeah, and for those of you who are interested, those QR codes are still up, but you will be receiving some information from our team with the recording. So you could always follow up at that time as well.
Have a great day and a great weekend, everybody.
Yeah.